Kim.
Thank you, Chairman. Thank you to the five of you. Ms. Deacon, I'd like to start with you. You had a very helpful testimony written, a lot of detail here. There's one part that really stood out to me. You were talking about the use of repricing and negotiation vendors. And you talked about this one case where the single claim actual amount paid to the medical provider was around $875,000. However, the total amount paid by the health plan was over $4 million, of which Cigna retained about $2.5 million in administrative and other fees, and multi-plan retained around $677,000 based on its repricing agreement. Can you explain to me and to the American people what is happening here in that example that you talked about?
Right. In this example, a member goes to seek claim. In this case, it was a particularly high-cost claim. And the claim was submitted by the provider to the insurance company, in this case, Cigna. Cigna engages behind the scenes a third-party vendor to help negotiate the price of that claim down. The way that the incentives are structured, however, behind the scenes, Cigna gets to keep a pretty big chunk of the savings that are generated, as do their third-party vendor. So in this case, a claim was submitted, again, a high-cost claim. It was negotiated down to $875,000. So that's what the provider actually got for providing health care. And as you mentioned, Cigna kept $2.5 million, and MultiPlan got $677,000 in order to negotiate that down. Now, when we're talking about administrative waste and bloat in healthcare, $875,000 of that $4 million claim paid was healthcare. The other 79% of that $4 million is not healthcare.
I mean, 79. I mean, it's mind-boggling to me. Just when I hear that, and the question is, what value does that bring? You know, what value is that 79% compared to the cost of what the actual medical provider got for the care that they provided? And it frustrates me so much in terms of how to justify these costs. I see the importance of what you're saying about transparency, because that's a perfect example of that. But I will also say that alone obviously is not what we need to be thinking about. And I thought you encapsulated well. You said here in a different part, profit seeking is expected in any corporate structure, but in healthcare, it's concurring in a system that lacks the most basic market safeguards. Transparency is one, but so is competition and accountability. I think the five of you have all talked about how much we're lacking, especially when it comes to competition and accountability. Dr. Miller, I wanted to just ask you, I was intrigued by what you said, about retrospective merger review. Can you go into that a little bit more?
So the FTC is a smart organization, and when things don't go the way that they expect, they tend to take their industrial economists and have them study what they did wrong. So for a long time, the FTC lost at hospital mergers, and then they undertook a retrospective merger review to figure out what their analysis and strategy was getting wrong, and changed their strategy and analysis, and has done a much better job and has actually kicked butt on hospital merger review. I think we need to do sort of the same thing with PBMs. The FTC approved a lot of PBM mergers thinking that they would decrease price and not result in monopsony power in purchasing when facing pharmacies, and independent pharmacists have struggled. And so I think we need to have the FTC take a look at all the PBM mergers that they approved over the last 25 or 30 years, figure out what their analysis got wrong and how they need to change the strategy of looking at these going forwards.
Mr. Potter, what's your thought on that?
I agree that 100%. One of the things that we found in our research is that these companies are getting far more money, in many cases, from their PBMs and their other delivery organizations than they are from their health plans. At CVS, which owns Aetna, that company gets more money, revenue, and profits from its PBM than it does from the company's almost 10,000 stores and from the Aetna health plans. Yeah. It is a huge cash cow.
Yeah, one thing I just want to add here as I end here, it's not just about the cost, it's also about the care. You know, a year ago, my father had major surgery, had to go to subacute facility. We learned at that point that he had signed up for Medicare Advantage, which literally limited the number of days that he could be there at in terms of getting the kind of rehab that he would. They didn't care at all what the doctor said he needed to be able to get back on his feet and be able to proceed. So it just, when we're talking here, it's not just about the costs that people are incurring, it's literally limiting and affecting the quality of the care that people are getting. With that, I'll yield back.